Good evening, everybody. This is Tiffany Roman, your host of Small Biz Highlight. I am here with Dr. Jenifer Epstein. We will be talking with her shortly. But before that, I just want to remind you guys about a couple things. First, if you are taking the time to watch us live, thank you. Please hit like, share, watch party, whatever your desire. But please be kind and share so that the word is spread around about today's episode. If you are watching us on replay, hashtag replay in the comments so that we know you stopped by. If you are stopping by and want to leave a comment, please do. Your comment may end up on the show itself during the episode, so you might get a little famous there. I am so excited about my Small Business Saturday event. If you have not heard about it, it's posted all over my page. I've posted so much about it. I'm in Facebook jail right now. I am not allowed to post to groups. So I am off tomorrow, though. So I'll be back to posting until I get yelled at again. But I am going to be hosting an event on Small Business Saturday, which is kind of going to be like a home shopping network kind of feel, where I'm going to go live and businesses will have a 10-minute slot to give it all they got to showcase what their business is about, what specials they've got going on, and you can shop right then and there. Give the links for people shopping and whatnot. It's going to be a lot of fun. I even have businesses offering gift cards and certain things for raffles, so it's going to be a blast. Please, if you take the time to check out the link. If you know anybody who may be interested, or if you yourself are interested, be sure to follow the page so that you can get alerted when we're live and keep up to date with what's going on. So tonight, I have my first doctor, my first professional person. I'm so excited. Dr. Jenifer Epstein. She is from Herhseyfamilychiropr. And I'm so excited because I feel like this is going to be a really fun episode, because I'm going to give you all those questions that you probably get asked a million times during the doctor appointments or like the prep appointments beforehand. But I feel like, as common as they are, there's still questions that sometimes people feel very shy about asking because they feel like, oh, she's probably answered this a million times. I don't want to bother her with it or something. So I just thought it would be fun. But first, I always start my show with a simple question. Who are you? Help us get to know you as a person before we start talking business.
Sure. So like you said, Jen Epstein, I have a practice out here in Hershey. I went to Central Dauphin High School, class of 2000, best class ever, go Rams. And I have a son who is 12, and I have a husband who works for Central Dauphin School District. I have 2 dogs, Pepper and Stark, because my family is like a huge Avengers, DC comic nerd. My family likes it. I'm the real nerd. Like, I'm the one that is obsessive over it. And I use my 12-year-old to get to those things.
As it could be.
But we've seen every movie, and that's just kind of like my secret obsession. I'm absolutely in love with it.
There's no shame in it. There's no shame in it. I still can't watch the ending of Endgame without crying. So
I can't even.
No.
Yeah.
Yep, I am right there with you.
Fabulous. Well, good.
Okay. Yeah, I'm right there with you. I don't have to use my kids as an excuse because my kids are 5 and 4. They don't know what the heck is going on. But we have been secretly putting in an Avenger movie here and there, a superhero movie, so that we could eventually get to that point where we'll watch them in order, like you're supposed to. And
absolutely,
go in there. Gotta educate them early. That's right. But yes, I definitely feel you on being the geek about Marvel. I am right there with you. So I'm so excited, like I said, about having you on here because I have not had a doctor here before. So how long has your practice been open?
So I've been practicing since 2007. The practice that I'm in now, I took over in October of 2018. I just happened to see online that there was a practice that was for sale. The doctor was leaving. Yeah, and I mean, not even 20 minutes from my house, and I love Hershey. So when I saw that opportunity to take over a practice, I was all over it. So we came in, yeah, it was October of 2018. So it's been a little over 2 years right now,
Oh, that's
which
great.
is crazy. I can't believe how fast that went.
How crazy, like, kismet is that it's like 20 minutes from your house? That's like a
Right.
dream for everybody to find a job where they're super close to home, right? Oh my
Yeah,
goodness.
exactly. Exactly. And it's, it's just far enough away that I can kind of decompress for a few minutes after work because we do see a lot of patients here. But it's not too far that it gets tedious. So
Oh,
it's perfect.
wow. No, that's great. That's exciting. Congratulations. So, all right. So technically it's been a previous practice, but it's still kind of new to you. So that's still exciting.
Yeah.
Now, I'm sure that COVID situation did not make it so exciting when you had to shut down. What kind of did you shut down completely, or did you kind of maneuver to try and do like virtual stuff like other practices had talked about doing?
So really good question. So chiropractors were still considered an essential business during COVID. However, we were not able to see any person who was not acute. So we have patients who come in for wellness care like once a month or once every couple of weeks, whatever. We were not able to see those people. If somebody was an acute
Oh,
patient, we could bring them in and treat them then. And then, obviously document properly that they were in fact acute. And so it took our volume down a lot, which, was good and bad. But how I saw my practice at that point in time was a huge opportunity for us to really step up as an industry. Telehealth is amazing, and I say this all the time. My
yeah.
doctor, my primary is a nurse practitioner, and I have a nutritionist that I work with, and I have a therapist that I work with. So doing telehealth is absolutely amazing. But it's really challenging to diagnose certain things through telehealth, right? And especially when COVID hit, it just hospitals, urgent cares, other physicians' offices were bombarded with people who were sick. And that's not really what my office sees, right? So how I
Okay.
saw myself is, listen, I can step up and I can take charge of kind of the pain management and wellness, right? Where the other physicians can handle illness. And that's really, taking a little bit of that burden off of them. When you're in an ER, an urgent care, and you're dealing with somebody who has a life-threatening illness or injury, having somebody walk in and just simply say, hey, my back hurts, or I'm getting headaches, or I have neck pain, that's a completely different realm, right? And if you are, seeing somebody who's in an emergency situation, that's kind of where you want to be.
Mm.
Where I can step in is really be that person that, can see someone who is actively in pain, or especially right now that I don't have to just see acute patients, I can be that person trying to keep patients out of urgent care in the ER in the first place. That way, those physicians can focus on taking care of the people who are sick, especially right now. So I saw it as an opportunity for me to start working more collaboratively and alongside our medical counterparts, which is something we should be doing anyway.
Oh, absolutely. And I love that. I love that, it just seems so like teamwork basically
Mhm.
is what you came down to it. You wanted to figure out how you can support those people that were struggling with the sick and trying to get them good to go so that you could take care of the not lesser items, but like not the COVID situation per
Yeah,
se.
we've got an amazing, lovely group of physicians that are totally qualified and all about it. I chose chiropractic for a reason, and I'm happy to be doing what I'm doing for sure.
So, all right, as far as common misconceptions go, I saw
Bring it
in
on.
bring it on, she says. I love it. I saw a common misconception which confused me that it's a common one, because I don't see how it could, but a common misconception being that chiropractors are not real doctors. I did not expect that one. Why wouldn't people think that you were real doctors?
I don't think it's anything malicious. Like there's nothing malicious behind any of it. I think that's the most important piece is most people just simply have no idea what our education is, right? And, listen, I've grown up and I've had, primary care physicians, I've had, all sorts of different specialists that I've worked with. And none of them has ever recommended to me growing up that I go see a chiropractor, right? And so for the most part, it's just the not knowing. And so what I've tried to do is begin educating not just patients, but other physicians that, I paid the same, $218,000 to go to school. Like I'm still continuing my education in orthopedics, which is more another 300 credits here and more money here. I think what's happened is we've really lost our way in terms of what a doctor is. And I think, when we think doctor, we think pills, right?
Yeah.
And medicine is not bad. And like I say to my patients, it's actually quite lovely in appropriate circumstances, but your ability to write a prescription does not make you a doctor. Your credentials, your time, your experience, your expertise makes you a doctor. And so, yeah, I mean, chiropractic has been around for a century at this point, and we're still kind of answering that question. But I think at this point, it doesn't kind of ruffle our feathers as much as it used to. It used to be really frustrating because, like, listen, I spent 8 years in school too, right? Like I put all this time and heart and energy into my education. Why am I not being taken serious? And even when you look and talk to the medical community, they're never taught. I mean, if you go to a med school student right now and you say to them, what does a chiropractor do? And when is it appropriate to collaborate or work with a chiropractor? They have no idea. And it's not just that. When I'm in chiropractic school, nobody came to me and said, hey, listen, here's when you should reach out. And you should find yourself a rheumatologist. You should find yourself a physical therapist or an MD or a DO. Here's how you can work with a DO instead of fighting against.
Oh,
right?
Absolutely.
And so it's a huge area of just misconception and a huge area where we're just lacking proper education and information. And so I'm just very vocal about that. Like my entire reason for being at this point is just to get people to understand, like, just because it's not common knowledge how we're trained doesn't mean anything, really.
No, that actually makes a lot of sense. I feel like there's not just doctors, but there's a lot of different, people that should be teaming up to help make their jobs a lot easier, but they're not realizing that until it's gotten to that point where they have to reach out to them. And they're like, why haven't I done this in the first place? So yeah, I definitely can see how that makes sense. Yes. So this is one I have heard, and I'm a little interested to see what your answer is.
Oh gosh.
Once you start going to a chiropractor, you can't stop.
Perfect. Okay, I love this one. You're so right though, because I'll have to, like, once you go, like you become addicted to going, and I'm like,
I have heard this one.
And so let's break it down into a couple of different contexts, right? So if you decide one day you want to start eating healthy, and you start eating healthy and you feel better because you're eating healthy, do you then stop eating healthy because you feel better? Right? Or if you go to, if you go to the gym and you say, listen, I'm going to work out, I want to be toned, I want to have a 6-pack, I want to have like those cool lines, right? And then you have those cool lines and you feel really good. Well, I'm going to stop because now I have those cool lines. I don't need to work out anymore. No. Right?
No.
Or how about this? You go to a dentist and you get your teeth cleaned and they're gorge, right? Maybe you even get whitening, you've had braces, they're all beautiful and aligned, right? And then the dentist says to you, you know what? Everything feels really good. Don't worry about ever brushing your teeth again until they're gross.
Yeah, that's not how that works.
That's malpractice, right?
Yeah.
Eye doctors, you know what? You have 20/20 today. We got your contacts. You're good to go. Don't ever bother coming back here unless you crash a car or you walk into a wall. What are we talking about? Right? So like I have patients who come in and like Jen is her name. I'll use one patient. She had headaches for decades and almost every single day. Okay. Over 20, I think it was 23 or 24 years when we started. She doesn't have headaches anymore. They're gone. Okay. Why would you stop? Right? So I think that again, it's just a lack of education in terms of what a chiropractor is actually doing, right? That would be like, I'm addicted to brushing my teeth, right? Well, you should be, because it makes you feel good. It makes your teeth healthy.
Yeah.
It keeps you from getting cavities, keeps you from getting sick. It's really important. But then when we try to like take that and put it over into the chiropractic category, oh no, we can't go back. We can't go back, right? So when we put it in that context, it's like, oh my gosh, that's so silly. It makes complete sense, right?
It does. Yes. Just at the beginning with you comparing it to those, I'm just like, wow, I feel really dumb asking this question.
No, don't feel dumb. It's not dumb. There's nothing dumb. There's no malicious. There's none of it. It's just, we just don't think of it in that context.
No,
and there's nobody out there really saying anything. Like, when's the last time you turned on your TV and you saw a chiropractor doing a commercial about what they do? When's the last time your pediatrician recommended you take your kiddo to go see a chiropractor as they're developing and they're learning and they're changing and they're moving and they're cracking their head off of everything? Never, right? So we're in this really crucial piece in time where we're unhealthier than we've ever been. And so it's time to open our minds up a little bit. And
that's interesting. You see kids, how is that something that should be normal, like me taking my kids to the dentist and the eye doctor?
So very good question. So when you are a baby, you are in a space, right, that gets smaller and smaller and smaller over the course of 9 months. And then one day, when it's time to say hello to the world, you are yanked out of that small space by your little head, right? So when you think about infants, and you think about their nervous system, and you think about they're not totally developed yet as it pertains to their bones or cartilage, right? So there's trauma that can happen literally day one. And you'll see this, right? You'll see babies that have torticollis, babies. My son was a forceps delivery. That was a good time. Not at all. That was like traumatic for everybody. Yeah. And the baby at that point, yes, they should have their teeth checked. They get their head circumference measured. They get their vitamin K. They get all these things. But then we completely neglect their nervous system. And when you think about chiropractors, you think about, oh, they cracked my bones, which whatever. We don't crack bones or I'd be in jail. But you think about the spine as a set of bones. You don't think about the fact that your entire spinal cord is in there, and your spinal cord connects to and controls everything. And when you're an infant and you're a toddler and you're a young kid, this is when it's all developing, right? That you don't typically, not all the time, but you don't typically get braces when you're older, right? You get braces when your teeth are kind of moving and growing and developing. So you get that really nice alignment, that really nice smile. Why are we not developing our nervous system the same way? And I was crazy when I was little. I mean, I jumped off of everything I could possibly jump off of. I hit my head constantly. Then I got older and I was in ballet. I did field hockey. My body was being used and abused like my entire childhood, right?
Yes.
So yeah, I mean, we see newborns the whole way up through adults.
Wow. I would never have thought. Only time I think of someone going to the doctor or to the chiropractor is if they're having back pain, or if I didn't know about headaches, but I did see your video the other night where you were talking about soda for headaches. Little side note, I actually had a doctor prescribe me put on a prescription pad that I had to drink a soda a day for my
No,
headache.
you didn't.
Yes, I did.
I can't.
Yes.
And like, listen, all the respect and love, because, you know, listen, like being a doctor means that you have put your entire life, time, money, just soul on the line to like help people. So nothing but respect. But really,
Yes.
like your prescription to help somebody with a headache is please go drink a can of soda a day.
Yeah.
And if a dentist heard that, they would go out of their mind. Like, are you kidding me right now? Why don't you say, hey, listen, let's go see a chiropractor. I don't know if they can help you or not, but maybe this is a structure functional issue. Maybe you're not having headaches because you have a lack of soda or a lack of Excedrin. Maybe you're having headaches because you're stressed, you're tired, you don't eat enough, you don't sleep enough, or there's a mechanical issue with your neck or an issue with your nervous system. I don't know.
No one even, I struggle from headaches. I get them very often, migraines specifically, and whatnot. But I've never, ever in all my years had someone offer, you should go see a chiropractor for that. I would have never thought to do it. I think back when I think of a chiropractor, or like, I don't know, just bones in general. But I never would have thought to go see you for my headaches or anything of that nature. That's just crazy. You're blowing my mind, Dr. Jen. First, you're telling me I should be taking my kids to see you, and I'm like 5 years behind with my oldest now.
You're still so far ahead of so many people. That's what's important. And you hit the nail on the head. I mean, yeah, we deal with bones, but the bones we're basically just using as levers, right? And we're introducing more efficient, we're introducing full range of motion to joints. And I mean, that's really what we're doing. We're creating better function, we're decreasing inflammation, decreasing pain. And you know, we were brilliantly designed to where our body cannot process pain and movement at the same exact time. That's how our spinal cord was developed. So if you hit your finger with a door like I did last night, the first thing that I did was this.
Yes.
To hurt, right? Tears coming down. It was bad. So I'm shaking like this because your body knows if you're moving, you're not going to feel it as intensely. Okay, so that's how we were developed. This is how your spinal cord works. So this is why medicine, like we're talking like Aristotle now, okay? We're talking like back in the day. Medicine was movement and mobilization of the body. They knew that back then. So we lost our way many, many years later, but movement blocks pain. That's how it works. That's what we do.
I'm baffled right now. I have grown up. Let me tell you why. Because I've grown up in a household where my mom was a nurse my whole life. My dad was an EMT and is a dialysis technician now, and has been working in the hospital since high school.
Thank goodness for him.
And my stepmom is a nurse, and now she's in charge of like her own area. And everybody basically, I grew up in a hospital is what I'm trying to, and not in a bad way. Like I grew up with hospital people in my life, and I have always heard like my mom give medical advice about what I should do with the kids and whatnot and whatever, but chiropractor, my mom's actually the one that actually told me about, be careful, if you start going to a chiropractor, you're not going to be able to stop. And I'm just like, Mom, really? Why is it addictive?
I mean, you can always stop, like you have free will, but you know, it's just you maintain your car, right? You maintain your house, you maintain your health every other way. So why would you maintain your teeth and your eyes and your nervous system, right? It doesn't compute, if you will.
So, okay. Adjustments. You said you don't crack bones. Obviously, you can't crack bones because everybody be walking out of your office not being able to move because they'd be in pain. So what is it that the sound actually is?
So the sound, the easiest way to describe it is a release of pressure. Technically, it's nitric oxide gas, but it's pressure within the joint. So if you have restricted range of motion and you go ahead and you adjust that area, or you reintroduce full range of motion to that area, you're going to hear or feel a little bit of a release or a pop. And that's pressure. That's literally it. And for the people who are like, they're constantly cranking and cracking their neck all the time, the reason that they're doing that is because they're getting that initial, very short-lived release of pressure. The problem is they're doing it all the time, right? So I don't have my patients coming in here every day for a reason, right? So, it's always going to come back because they're overstretching their ligaments. They're creating, hypermobile joints at that point. But what they're feeling is a tightness. They're feeling a pressure. And when they move that noise is that release of that pressure. That's what you're hearing.
Oh, okay. Well, since you were pretending to, when you're doing your movement with your neck, we're going to talk about the scariest part of chiropractic. No. We were talking about this before the show, and I am so excited to hear your description about this because I have had an adjustment before, and it was absolutely the scariest part of it all. Every time a pop happened in my back or whatever, it was like, whoa, where'd that come from? Because it was never that intense, I feel like, when you try to do it at home by yourself than when you do it in the doctor's office. But the neck, we watch way too many movies, way too many fighting scenes that when you hear that crack, you think, oh, I'm goner. So let's talk about cracking your neck.
Absolutely. So we're going to talk about it in a couple different contexts, because here's the thing. If you look at, let's just talk about a really quick stat, right? So I think 65 or 67,000 people died last year of opioid overdose. Okay. This many died from getting their neck adjusted. That's a zero. Okay. So here's what makes people nervous. You hit the nail on the head. It's all the movies. Okay. Yeah. But it's your neck. It's a very sensitive area for people. You have a lot of very, important vessels that go through here. So you have your vertebral artery, okay, which is the one that people get very scared and, you can get a stroke, so on and so forth. Okay. Then you have nerves that come down out of the neck, go through and innervate, the arm, the shoulder, so on and so forth. So there's just a lot of stuff in there that people are very protective over. Yeah. So when you are grabbing and cranking, the direction that you're doing that in is actually compromising those things more than a chiropractor ever would. It's actually a lot more dangerous to do that. When a chiropractor is adjusting you, first of all, they've had a lot of training. It's not just something that, they went to a weekend program to learn. Okay. My 12-year-old can make noise with my back if I want him to. It is not hard to make that noise. No. But to do it properly and to do it at the, the right place and in the right direction is where the art form comes in. Okay. When you're getting adjusted, a chiropractor is contacting your neck back here. Okay. And back here, actually, I have something. We'll look at Fred really quick, because as a chiropractor always has a sign nearby, right? Yeah. So here's all the important stuff people are worried about. So these are the vertebral arteries coming down. Here's all the nerves coming out, right? So people are concerned about compromising that area. All right. When you're getting adjusted, the chiropractor is actually adjusting from back here. And all back here are joints. Okay. And those joints have a certain range of motion that they should be able to perform. Some of us have had an injury, or some of us sit at a computer all day long and look down. Okay. And the brain starts to sense danger or discomfort in that area and begins to tighten the muscles, which is why we feel really stiff, right? And that tightness will impede that range of motion that happens in the neck. So when a chiropractor comes through and adjusts this area, releases that pressure, it also basically stimulates the muscles and gives them an opportunity to go ahead and relax as well. We're retraining the brain at that point. And that's a reason why people have chronic pain, right? Because, you know, their brain senses danger, so they stop moving something and now they can't move it. And now they're overusing muscles and now they're in more pain. So this is the cycle that we're talking about. My job is to try to break that cycle. That's what we're working to do.
Wow. Okay. So I've seen doctors who do it side to side or whatever, and I've seen ones that do it the lowering the head to the side that way. Is there a difference to doing each or one or the other, or they both do the same thing?
It's a difference in terms of what segment you're adjusting, which is why when you grab your chin and you crank, you might actually be in a pretty line of drive with one joint, but you also might be grinding others, right? So when you're adjusting the very, very, very top of the neck, the joints go a certain way. When you start adjusting different parts of the neck, those joints are going at more of like a 45-degree angle. So you have to know that anatomy to be able to adjust it properly.
Oh my goodness.
Yeah.
This is nothing like I expected chiropractic to be. This is awesome. I actually have somebody who commented and she's asking, can you talk about tinnitus and sciatica?
Absolutely, I can. I'm putting Fred down. Hold on. Okay.
I love that his name is Fred.
Okay, so we can start with tinnitus. So tinnitus is interesting. It's an interesting animal in the sense of there's different reasons for it. Tinnitus can be caused by a mineral deficiency like magnesium. So there are people who will take magnesium that will actually, you know, have less of that ringing in the ears, which is what tinnitus is. Okay. Other reasons people can have ringing in the ears is nervous system dysfunction. The nerves that come out of the cranium, the nerves that come out of the top of the neck, that's what's innervating the head, neck, ears, right? So if you have dysfunction with the nerves in that area, that can produce that sound in your ears as well. Then you have all sorts of different inner ear issues that can cause ringing or that feeling of fullness in your ear.
Yeah.
So it has to be properly diagnosed in terms of what's causing it first. And typically what'll be done is we'll check out, you know, the mineral deficiencies first, go ahead and get somebody on some of those minerals to see if they start to decrease a little bit. And if it doesn't, we can go and work to treat other things. Sciatica, and this is huge. A lot of people think sciatica is a place. I'm pointing to my butt. Hold on. We'll get Fred again. So a lot of people think sciatica, because I want to point to my own butt on screen. So sciatica, people are pointing to their low back. Oh, my sciatica hurts. Okay.
Yeah.
So that's not the case. Okay. So this is what's called your sacroiliac joint. This is a joint. Okay. So your low back or your SI joint can hurt you. Okay. Sciatica is a condition where the sciatic nerve is either compressed within or around the sacrum, or there's muscles around the butt that can compress it as well. Your piriformis, for example. In order for it to actually be sciatica, it's almost like you could draw a line down the back of your leg, past your knee into your calf. That is truly sciatica.
Oh, wow.
So again, there are specific orthopedic tests that we would need to do to make sure you even have sciatica in the first place.
Got it.
Then we need to see if in fact you do have it. Is it because your muscles, right? You sit on your butt all day long. You don't get up, you don't stretch. Now your piriformis, your hip flexors, your IT, everything is super tight. And now the nerve is compressed. Or do we have a disc issue in the low back that's starting to compress that nerve, causing it as well? Once we know where it's originating from, then we can go ahead and go in and decide how we want to treat it.
Oh, wow. So I'm putting 2 and 2 together here. I know you said that a lot of doctors don't know they should be teaming up with you and whatnot, but it's not every time you talk about like how you would treat something and whatnot, it sounds similar to if I went to do physical therapy.
Yes,
Stretching
we
and
love our PTs, absolutely. And historically, and this is changing, historically, PTs and chiropractors have been this way also, which I don't understand. I'll never understand it. But we love our PTs, and they've been an incredible help, to us in terms of what we do in our job, helping to even increase flexibility even further, so that we're able to get better adjustments, better retraining of the nervous system. So it's an incredible partnership that's not taken advantage of enough, honestly.
wow, yeah, because I was gonna say it sounds like it should be if my doctor's writing me a script to go get some PT for something, I feel like chiropractor should be involved with it as well, because it just seems like you guys would go hand in hand all the time for the
Well,
most part.
the muscles are connected to the ligaments, which are connected to muscles. So it's very almost impossible, I would think, to have an injury in one place. They work together, right?
Yes.
So just from an anatomy physiology standpoint, I think it makes a ton of sense. And it's not just PTs. I mean, I work with a podiatrist here in Hershey, and she specializes in leg length insufficiencies. And I have patients who come in with one leg longer than the other, and it's created a functional scoliosis over time. So, I can treat and adjust that patient every single day, but if we don't work on or fix that leg length insufficiency, what are we doing, right? So
Yeah.
there's another really good partnership as well.
Oh my goodness. Dr. Jen, I am loving talking to you. No, I'm so serious. First of all, you're really fun to talk to, which is great. But I love the information you've been putting out because, I'm so glad I pulled up that list of common misconceptions because I feel like you just blew the roof off the place. Like, the chiropractor should be a regular, just like your eye doctor and your dentist. Just put it in there. Like you never think that. Now listening to you explain why and the reasons people come to see you, I feel like if people would start seeing you sooner in life, then maybe they wouldn't have those other things. Maybe
Sure.
At least try to prevent it early. So, it blows my mind right now. I feel like I need to call your office and be like, I have a 5-year-old and a 4-year-old who need to be evaluated. I need to make sure. Because, I'm thinking about kids. My kids, you're probably going to laugh if I tell you this. My kids started to walk with like their feet kind of, what is that called when it's separate? When it's like
pigeon toed and then when it's
turned
out
a little bit. So our doctor told us to put the shoe on opposite feet to kind of force it to go in, and it worked. They're looking okay, but I'm just wondering what would have been different if I went to a chiropractor to tell them my kids' feet are pointing sideways.
I mean, again, I think, when they're pointing outward, is it in fact coming from the foot and the ankle, or is it coming from the knee or the hip, right? So that's the first thing you have to determine. And listen, putting the shoes on the opposite feet is going to do a lot less damage than drinking a can of soda every day. Do you know what I mean? So I don't have any feeling other than if it works, that's awesome. I mean, it's not going to hurt the kiddo, and that's great. You just have to make sure not to necessarily forget that, that closed kinetic chain, meaning, it's connected to the knees, to the hips, how the song goes, right? So just making sure that all those things are nice and healthy as well.
Wow. Goodness. Well, if you're just jumping on and watching us, you missed it. You need to wait till this video is done recording and rewatch from the beginning. Dr. Jen has been amazing breaking down some common misconceptions and then my crazy comments and questions that I added on to it about chiropractic practices and why it should be a regular doctor visit just like any other doctor in your life. I definitely can see the reason for it, and it totally makes sense to me now. It totally makes sense to me now. you know, if you are watching, thank you for stopping by to watch. I much appreciate it. If you are watching, please remember to like, share, leave a little heart. No unhappy faces. We don't do those faces here. If you are catching us on the replay, hashtag replay in the comments. If you have any questions for Dr. Jen, you can certainly reach out to her directly, but leave a comment in the comments. I would love to be nosy and see what the answers are. But beyond that, you know, I had a great time talking to you. I really enjoyed listening to how you explain things. It was out of the box kind of way, the way you explained it, and it made a lot of sense. And I really hope that people who do take the time to watch it understand it to the level that I was able to, because yes, I am a total new understanding of chiropractic. How do you say
Chiropractic, you got it.
Yes. But yeah, so like I said, thank you so much for taking the time. I know you're so busy and have like a ton and whatnot, but thank you for your time. Thank you for stopping by the show. I really appreciate it.
Thank you for having me.
I'm so grateful to you for doing this.
Thank you.
Everybody, I hope you enjoyed the show. Like I said, just comment in the comments if you have any questions. But with that, I shall leave you for the evening. Thank you, everybody, for stopping by. Have a great night. Goodbye.